Gentlemen, welcome to this new episode of Medcast, your gateway to the latest medical updates and the replying to the rumors we have in the society. Today, we are exploring the importance of maintaining a healthy lifestyle and diet, offering practical tips and expert advice to help you make smarter choices for a happier, healthier you. From balanced nutrition to staying active, we are here to guide you on your journey to optimal health. With the honor to have Dr. Hussain AlSarraf, who is a clinical dietitian and a holder of a Bachelor of Nutrition from Canada, and as well as holder of high diploma in diabetes. Welcome, Dr. Ali.
Thank you.
Thank you so much, and we are so happy to have you.
It's my pleasure.
Again, I apologize for the mistake I'm having with the name in the beginning because
My dad will be happy. It's fine.
Okay, that's fine. He will be proud.
Yeah.
So, Dr. Ali, let's speak about general diet we have and the habits we have in the society. First
Sure.
of all, what are the basics you always advise, let's say the consumers, let's say the patients, to have in their healthy lifestyle of diet on a daily basis?
Sure. Now, Ali, as you know, with social media, we get so many information, not as a specialist, but as like regular follower. We many times see many videos or posts related to nutrition nowadays,
Yeah.
and people get influenced by many, say, informations or many new emerging diets.
Yes.
But unfortunately, many of these information or say data are not really scientific sometimes.
Yes.
So you really need to pay attention with that point. It's always important to have and maintain a balanced diet in order to have proper nutrition overall and good health.
Well, sometimes I say in Kuwait now we are the country of the thousands experts in nutrition. Everybody is speaking about everything related to nutrition. That's
Yeah.
why they have sometimes, let's say, invented new systems or diet systems,
Yeah.
and they tried to reinvent the regular systems we already have in science. As example, we have the keto, we have the paleo, and we have
Yeah.
the intermittent fasting, such as sometimes you advise the patient like to take meals in certain time and leave the meals for
Yeah.
the other
And stay
time.
fasting,
Yeah,
yeah,
and
for
stay fasting for the
certain
other time.
duration of
So,
the day.
to
Yeah.
what extent you agree with these systems?
So, going back to the background, actually, some of the diets are actually medical diets.
Hmm.
For example, the keto diet, it's originally ketogenic diet.
Hmm.
So it's simply for people who do have seizures.
Hmm.
It's originally it was for these people who have seizures. They tend to have better or say lower frequency of seizures once they follow ketogenic diet.
Hmm.
But the medical staff so that once people follow this diet, patients tend to lose weight.
Hmm.
Hence, people got this diet as a way to lose weight.
Yes.
And as you know, because ketogenic diets rely mostly on eating protein and fat,
Hmm.
and many people in our community do like eating protein and fat, and can, for the sake of weight loss, at least like cancel carbs like rice, bread, and some other carb sources. Hence, they would see results. Yet, it's not always appropriate for all people to follow such diets.
Hmm.
As we said, ketogenic diet relies mostly on protein,
Protein intake,
and
yes.
people tend to have maybe a high consumption of, say, beef, for
Hmm.
example, which at the end may lead to higher cholesterol levels.
Yes.
Some people tend to have high uric acid levels. So, on one side, you'll be losing weight, but on the other side, you'll have some negative aspects.
Hmm.
Also, some people, for example, if they don't have such, say, negative aspects, yet some of them actually tend to go to gym. But with ketogenic diet, it's not the most, say, proper
Appropriate.
plan
Yeah.
to follow for people who are athletic,
Hmm.
because simply you do have very low intake of carbohydrates, and as you may
Which is,
know,
I think, it is the best energy source
yeah, it's
somehow.
the fast, say, absorption source and the easy, absorbing source of energy for the
Hmm.
body. So once you are having, because it go as low as 5 to maximum 10%,
Hmm.
so it's not really anything. When you talk about food, it's mainly like equivalent to one piece of bread
Yes.
and one piece of fruit maybe for the whole day,
Hmm.
which is not really sufficient. You likely need just
More
this
than that.
amount just for the pre-workout
Hmm.
aside from like other meals during the day. So with such plans, it's not really appropriate for all. it will have some drawbacks.
Okay. Now,
Yeah.
with the other systems like the paleo and the intermittent fasting,
Mhm.
so how would you apply these plans to a patient or any consumer?
Sure. So with intermittent fasting, let's focus more on it since it's popular now.
Yeah.
So intermittent fasting is really more an approach. It's not a diet. Some
Mm.
people mix up that it's like a plan. When they
Yes.
say when they go to a dietitian or an expert, they tell or ask the expert, what should I eat
Mm.
when I'm following intermittent fasting? It's an approach. It's not like a specific food regimen or routine to
Mm.
follow. So simply a person can eat whatever he is used to eating, yet he need to follow, as you said in the introduction, that he need to follow certain routine
Mhm.
with regard to the timing, to the portions. So there are actually several approaches whereby some people do fast for 14 hours, 16 hours, 18 hours, or some people do more. The most common is the 16 hours fasting. So we tend to have 16 hours of fasting.
Well, if you have 16 hours of fasting, then you would have only 8 hours to sleep,
To
not to eat. Yeah.
actually, most of them like would reverse,
Oh,
like
okay.
they will count the sleeping or dedicate the out of the 16 hours, they would dedicate or like schedule that part of the 16 hours
Hmm.
would be in the sleeping time. So,
Hmm.
say for example, they would start eating, so they have 8 hours of eating, so they would start eating maybe say around noontime, and they would stop eating around maybe 8 p.m.
Hmm.
So from 8 p.m. until the next day till noontime, they have or should not be eating anything. But some people follow like the dry fasting approach where they can still have water or say tea or coffee
Let's
without
say
any
the
sugar.
the zero the 0 calories drinks.
Yeah,
Yeah.
true. So with these diets, people need to ensure because many people think that if I'm sticking with these timings, I can eat, sorry, anything during the 8 hours.
Hmm.
Yet you might end up seeing no results.
Yeah.
Because just going back to Ramadan, for
Mm.
example, we do tend to see some people who actually lose weight
Hmm.
during Ramadan, while others gain weight.
Mm.
It's all dependent on the amount and the type of food you are eating. So by the end of the day, if you are following the dietetic requirement or the caloric, sorry, requirement that your body needs, you will be having a stable weight.
Hmm.
If you go less, you will lose weight. But you are eating like countless food, you
Especially with
will,
the sweets in Ramadan
yeah,
because they are so special. Yeah.
true. So, yeah. So by that, they will be actually gaining weight, not losing weight.
Now, as we have started our episode, we have mentioned that there are lots of experts we have nowadays,
Mhm.
especially in the social media, and every
Yeah.
one of them are proposing a plan for anybody
Mhm.
that tends to go into a diet or to lose a weight or
Yeah.
at least to live a healthy lifestyle.
Yeah.
But sometimes there are some plans that they are not legitimate. So
Mhm.
how could you advise the people to differentiate
Yeah.
between the legitimate plans and the
Yeah.
other plans everybody's doing?
Sure. It's always important to note that the diet should suit you in terms of because once we need to follow a diet, the dietitian or the experts need to ensure that he gets some information. For
Hmm.
example, age, weight, height, food dislikes or allergies, of course, the gender, because we tend to have a formula whereby we use it in order to figure out the proper calories that the person needs.
Yes.
So if you know that someone got this information, you would know that the diet will be tailored to you.
Hmm.
Then going and reviewing the blood tests ensures that you follow or at least sorry got a plan that suits your body according to the blood test. Say
Hmm.
if you have low iron level, you will be needing to focus on high iron sorry foods.
Yeah.
Uh, if you have high cholesterol, you will need to pay attention to some foods and omit and focus again on some foods to lower the high or elevated cholesterol. Aside from that, you need to know that a diet is balanced where it's not canceling a major group. It's not canceling, for example, carbs, nor protein, nor fat.
Hmm.
So it needs to be balanced because these three major groups actually each of them do play a role. So
Hmm.
carb, as we said before, does provide energy. Protein ensure you have good muscle amount in
Hmm.
your body, and the fat also aside from being as we call it the slow or long-term energy
Energy
source,
source.
it also plays a role in building up tissues and also the brain. Aside from some of course fats like especially the uh, unsaturated fats
Mhm.
tend to have beneficial effects like lowering the cholesterol and some other benefits as well.
Now, where's the misconception that the most of our friends or people or relatives they have
Mhm.
is that they count the carbs as always as sugars. So
Yeah.
how can we differentiate between the carbs and the
Okay.
sugar intake?
So the carb overall is, say, it's the big or the mother group.
Hmm.
So that's the big term.
Hmm.
Then from the carb itself, we have subgroups, as we may call it. So as you said, there is simple sugars,
Hmm.
which is usually the white sugar and maybe also the honey, some other simple form of sugar. And then we have also the foods which tend to have like complex carbs.
Hmm.
Of course, some foods may contain some say mix of simple and complex sugar. For example, white bread will have mostly simple sugar with little complex carbs. On the other hand, whole wheat products like brown bread or rice or pasta would have more complex carbs and very less, say, simple sugar.
Hmm.
So people need sorry to focus on having and consuming whole grains. So having more, at least the recommendations say that at least half of your carb intake should be whole grain during the day.
Hmm.
I always emphasize that mostly in Kuwait we eat like white rice
Yes.
on lunch. So aim at least that you have whole grain bread or say grains like pasta or some other forms to be whole wheat
Mm.
on breakfast and lunch as well.
So does that make a difference? Because you have mentioned the lunch and the breakfast, and sometimes they
Mhm.
always say if your healthy lifestyle of diet
Mhm.
is including breakfast, it's better
Yeah.
than including a heavy meal on a dinner. Is that fine?
Yeah, at least I always see that out of say what we notice and the lifestyle that we are living in Kuwait,
Mm.
many people do wake up, so they have also work to do and going simply to work. So if you tend not to have breakfast, many
Hmm.
people tend to graze
Yeah.
during the day, sorry, and then maybe they end up having like sweetened beverages or coffees
Mm.
with creams and the syrups. So they are saying that I don't have breakfast, but they are actually on the other side having more
More calorie
calories
intake than the
from other
breakfast. Yeah.
other sources.
Mm.
All the day they are thinking I'm not having only maybe two main meals,
Hmm.
yet you are having many snacks eventually, because during our work, especially at the very first visit, we have something part of like our daily or say, sorry, the requirement of our job that we go through 24-hour food recall,
Hmm.
and especially the first visit. So many times I do see these say mistakes. Many people say I'm not losing weight and I don't know why. So I start going through his food recall. Then I tell him you're having more calories from here, there. So then he get to
Then
know.
he knows his mistakes.
Yeah,
Now, one more last questions because we are ending up
sure.
our episodes. Would you prefer or recommend
Mm.
eating the fruit or drinking the fruit?
Of course, it's always better to eat fruits.
Hmm.
You will end up hydrating your body as well if you eat fruits.
Hmm.
Yet you will have more vitamins, more minerals, and especially more fiber.
Fibers, yeah.
Because fibers, many people actually are not aware of the benefit of fiber. So
Hmm.
fiber do increase satiety. So if you always complain of being hungry, especially now we have longer evening times,
Yes.
so aim to have more fiber, whether it's from fruit or even vegetables. Fiber also plays a role in regulating blood sugar,
Hmm.
cholesterol. If you do experience constipation, fiber would be the solution.
Hmm.
So it does have many benefits. So eating fruit is way better than drinking the fruit.
Dr. Ali, that was very fruitful speech from you, and we are so honored to have you today. Hopefully, we can
It's my
have you
pleasure.
again to discuss
Sure,
the more specifications or details about the diet.
sure.
Thank you so much.
Most welcome.
Our dear viewers, we have reached to the end of our today's segments with Dr. Ali Hussain AlSarraf. Hopefully, we can meet you again with another medical professional. Until that time, see you later.